Well, women have been choosing to have breast augmentation for decades, but while it's a popular procedure, lots of women don't really know much about it. Well, lucky for us, Dr. Gary Price from the Price Aesthetic Surgery Center is here to separate the fact from the fiction. Well, welcome back, Dr. Price. Great to have you on the show again.
Great to see you again, Desiree.
Now, listen, I was actually pretty surprised to find out that breast augmentation, breast surgery, is actually the most common surgery you find in your field.
That's absolutely true. It's the most common cosmetic surgery done in any typical year in the United States.
Versus liposuction or the rhinoplasty, women, we want to have fuller breast.
That's right.
So talk with us a little bit about the age. I mean, it's not something that all younger women are doing. I mean, for us in our 20s, some of us in our 20s, rather, I should say, as I wink, you're saying that's not necessarily accurate. You're seeing women in their 30s doing it, in their 40s. There's really no age restriction.
I think you might find this surprising, but even though there are lots of women in their 20s who have this surgery, the average woman nationwide is actually a 36-year-old mother of two.
Really?
She's just trying to get back what she lost with those pregnancies.
Because there is a lot of wear and tear in terms of our bodies taking a heavy hit when we have babies, and then even fluctuating in weight.
Absolutely. There's stretching. There's also a loss in volume or size of the breast for many women.
Now, tell us a little bit about hospitalization, because if I were to come in, I think that would be one of the big things on my mind. How long am I going to be out of work, and how long am I going to be in the hospital?
Well, that's another surprise. Most women who have the surgery done actually never go to a hospital. Last year, the majority of them were actually done in outpatient operating rooms affiliated with a doctor's office. In my practice, we have an accredited operating room that's actually licensed by the state of Connecticut. And the studies that have been done have shown that if you have your surgery in that kind of facility by a board-certified surgeon, it's just as safe as in the hospital.
Good to know. Separating fact from fiction, we talked earlier, and I had asked you in the green room earlier when he was here, women that are going to have babies or already have their children, is it a hazard to have a breast augmentation? Is there going to be a hindrance in breastfeeding or no?
Not that we know of. The FDA does ask us to warn women that no studies have been done to look at that.
Right.
But the surgery itself is actually done behind the breast. We never actually touch the breast tissue when we're doing the surgery, and I certainly have lots of patients who breastfed after the surgery.
Well, that's good to know. And talk with us about no general anesthesia needed. That's what you're saying, that you don't have to be under completely.
Yeah, that's another surprise. But for over 20 years, we've been doing this kind of surgery with a technique called local anesthesia with intravenous sedation. And what that means is that you get some intravenous medication that makes you so relaxed you just drift off into la-la land.
Oh.
You're totally comfortable, not aware of what's going on. But you don't need general anesthesia. You do not need anesthetic gases, none of the paralyzing agents that go with that. And it also makes recovery a little quicker.
Oh, I bet. Big time. Now let's talk implants. I want to talk about what you say that we have to choose from. What are the different types? I think it's saltwater, you said?
That's right, saltwater or saline implants.
Okay.
And then the other choice that's available now is also a gel implant that is filled with a silicone gel. This is a typical gel implant.
This is the gel implant here. And now, again, what is the difference?
Well, the saltwater or saline implants are filled with water,
Okay.
whereas the gel implants are filled with a kind of cohesive silicone gel. The saline implants, if you have a leak or a deflation, your body just absorbs the salt water. With the gel implant, the gel just sort of sits there.
And what is this one here?
This is a gel implant, but it's covered with a textured surface. That's one of the options that women have.
And let's show this if we can. Dr. Price, explain this, because this one you said you use for women who have suffered from mastectomies or had breast cancer, right?
Yeah, it's most commonly used for that. This is a teardrop or shaped implant. And you can see that.
Tips down.
Yes, it sort of mimics the shape of a natural breast.
Now, which one would you say is safer?
Well, I don't think that you can say either implant is safer than the other.
Okay.
They have pros and cons, something a patient needs to talk with their surgeon about a lot. The saltwater implants have a little bit lower chance of needing maintenance work down the road.
Okay. Now, let's actually take, if we can, we've got a picture, a graphic, and explain to us exactly what happens when you get ready to have the procedure done.
Well, this procedure shows the implants already in place, but what the surgeon does is position that implant through a very small incision, either behind the pectoralis muscle, which is shown there on the left, or behind the breast but on top of the muscle, which is shown on the right. Your surgeon may inform you that for one reason or another you may be a better candidate for one type of surgery versus the other. Mm-hmm. This is something you need to talk with your surgeon about.
Absolutely. And let's talk about this kit, because I love this kit here that you brought, that you can actually get coming to you, calling you all on the phone and just saying, hey, listen, I want to try one of these. For women who are considering having breast augmentation, what comes with this kit?
Well, this is a great new idea from one of the manufacturers, but it comes with a DVD about the surgery,
mm-hmm.
a booklet to give you information about it, and then the most interesting thing is this kit comes with a bra that's made to slip these sample implants into.
So let's show that, Dr. Price, because what you did earlier was, here's a bra, ladies. This is what it looks like here, an actual bra. And this will come in the kit. And then inside here, inside of this, let me turn it around, inside here is where we slipped in. Can you take that out, Dr. Price?
Exactly.
And then we'll slip it back in for folks. So you can actually try this on in the privacy of your own home. And then it goes right in. And then that's what it basically looks like. And you can kind of see if that's something that you, depending upon whether or not you really want something like this.
Exactly. And the kit comes with 4 different sizes of implants, so you can experiment with which size and see what you're really happy with.
What really works for you. And I have to say, because I love this, I asked them, I said, listen, can we tell folks how much this is? You said yes.
It costs the patient roughly about $40. They can find out how to order it from my office. And it comes with a booklet full of rebates that are actually worth about $270, so it's well worth the cost.
And if you'd like more information or have any questions about breast augmentation, I had a million questions for Dr. Price. He answered for me in the green room. We'll put the information on the screen for you right now. You can contact the Price Aesthetic Surgery Center. Write their information on your screen at 203-453-6635, and their website is at the bottom of the screen. Or come to our website, WTNH.com, click on Connecticut Style, and we'll get you the link. Dr. Price, thank you so much.